In this video, we're going to go through the basics of creating your very own current reality tree. So the benefits of creating a current reality tree are that you're able to systematically identify your root causes, and you can visualize these complex interdependencies that affect your system. And this can be with patient care, staff efficiency, organizational performance. Once you have this all laid out in front of you, everyone's able to visualize it together. And this is where you really get this collaborative problem solving by providing a clear picture of your organization's current state and the problems that exist. You're able to really focus in on that root cause together. For tips for this, we do recommend using either a digital program or sticky notes on a wall. Whichever one you choose, you're going to end up needing a lot more space than you think, and you're going to be moving a lot of things around. And there's a lot of different types of programs out there that can help you kind of flow map this. So starting with the current reality tree, you need to identify what your undesirable effects are. These can be anything. I chose 4 that are close to medicine, just to kind of demonstrate. So we chose low patient satisfaction scores, long patient wait times, patients are spending more time in the waiting room, and our clinicians are seeing less patients per hour. Tips for these is that each undesirable effect, which we call UDI, should be clear and concise and in present tense. You should use language that's understandable to all of your stakeholders. And you want to focus the UDIs to the issue. So you don't want to add any blame or emotional bias to these. These are logical statements that you can find factual evidence for. So you can choose just a few to start with, or you could have many. But once you have them all kind of organized, you're going to group them up and space them out horizontally. And for this, you're going to want to leave space and be prepared to rearrange like entire portions of your tree. You might be moving them kind of to and from as you work down your tree and figure out the root causes for your UDIs. So the first thing you're going to do is pick one, and you're going to determine the cause and effect relationship. So how you do that is you ask why, or what causes this, and then you place the why in the separate box below that box, and you draw an arrow that establishes the relationship. So our clinicians are seeing less patients per hour. Why? Because our beds are full. A tip for this is you might have multiple UDIs that fall in line. If you happen to pick, like, our beds are always full, then this box would also be red. But you just keep plugging those in as you work your way down. And after you have this cause and effect relationship, you want to apply any and or logic. So does this cause and effect occur in isolation, or is there something else that goes along with it that causes your UDI? So you kind of want to ask, is that all? Is this the only scenario? And when you use the and logic, it's signified by joining the arrows with this oval shape. So it would look something like this. The OR logic version of this would be just the arrows without the oval. So in this scenario, we have our clinicians are seeing less patients per hour. Why? Because our beds are full, and because our clinicians evaluate patients in beds. A tip for this is if you have multiple ands, make sure you need them all to satisfy the logic. Sometimes you have just a couple ands, and then you have multiple ors that come off of that UDI. Now that you have your first set of cause and effect relationship, you just want to keep asking why. So you just keep going until there's no more whys. So you would take each section, our beds are full, and our clinicians evaluate patients in beds, and you just ask why. So in this scenario, our beds are full. Why? Patients are in beds longer. Or why? Because we have a nursing shortage, so we have less available beds. Why are our patients in beds longer? Because our imaging turnaround times are longer. Or admitted patients are boarding. This could also be an and or an or depending on your system. Sometimes you need both of these to really cause your problem. Sometimes it can be an or. Going off of the nursing shortage. Why? Because we have high nursing turnover. In this scenario, let's make the imaging and the admitted be an and. And why are our imaging turnaround times longer? Because we're low on transportation staff. Why is our nursing turnover high? Nurses are working outside their scope of practice to help with other shortages. And then we can actually connect that we're low on transportation staff and we're having our nurses do a lot of transport. And a tip here is that This will take a while depending on your system and how complicated it is, so be prepared to schedule additional time. The sample that I'm showing you is very much simplified. So once you have your tree complete and you're going to have multiple UDIs in this tree and it's going to be very large, you want to validate your tree by using if-then logic, and you want to read from the bottom to the top. Clear, and then also adjust any of your and or boxes. And then the last thing you're going to do is show this to others and see if they come up with anything different or if they can further edit it. And you want to involve subject matter experts. So consult with the individuals who have expertise in this specific area. What might be very difficult to kind of tease out for you would be very easy for them. And you want to revise this. You got to be willing to adjust or even remove links that fail validation tests. A tip for this is asking, is this all that it takes? So if you're looking at low transportation staff and imaging turnaround times longer, is this all that it takes to make imaging take longer, or is there something else, like you don't have enough staff in radiology, or you don't have enough radiologists reading your films? So you really want to drill that down. So once you get down to the bottom of your current reality tree, you're going to find these fundamental issues that have significant impact. So these issues at the bottom we call root causes. And you're going to focus your fix here, because if you're able to resolve these fixes, this whole tree kind of collapses up. The things above it all get fixed. That's one of the benefits of complex systems, that fixing one thing can actually help improve many things as they kind of move up the tree. So in this particular case, we would focus our fix on our transportation staff. While you're going through this process, you're going to come up with core conflicts. You're going to have a policy, a mindset, or a system limitation that makes it very difficult. And you're going to be able to determine this root cause together, but maybe stuck on a core conflict. This is where a conflict cloud can come in to help break that conflict for you and your team. Just some extra tips for building your current reality tree. You want to make sure you're very specific. So you want to ensure that all of your UDIs are clear and measurable. You want to validate each cause. Don't make assumptions. You want to verify with evidence. If you make a false assumption, you could lead yourself down an incorrect pathway. Make sure you challenge everything with the if-then connections and do the double check on the way up. It's very important. You also want to simplify where you can. Don't add extra complexity that might not be needed. Involve your stakeholders to validate your CRT with you. Make sure that you have actionable causes as your root causes. That will ensure that everyone can focus and actually get some work done on that root cause. You want to prioritize the primary constraints, so focus on the biggest issue that comes out of your entire tree. And at the end of the tree, how you know you're done is you've linked every UDI and it traces back to a root cause. And just another reminder that UDIs can fall in line with each other. I provided this example below. Patient satisfaction scores are low, and if you had another UDI that was patients are spending more time in the waiting room and people dislike prolonged waiting, then this could reflect in your low patient satisfaction scores. So your tree can look very different depending on the UDIs that your system chooses and how you decide to logically lay them out. And that wraps up the basics for creating a current reality tree. The only thing to do now is to make some on your own.